Hi, I'm Dr. Rabab Zaidi. I'm a general dentist here at Dr. Rami Hamid Center. And today we're going to be talking about gum disease and why gums are actually very important to your overall health, not just your oral health. So you might be wondering what exactly gum disease is. As a dental professional, we do call it periodontal disease instead of gum disease, but it can be known as both. So basically, gum disease is, or periodontal disease, is something involving your periodontium, which involves your gums, the bone surrounding your tooth, and the ligaments that hold your tooth together. So this is the periodontium, and what gum disease does is that it basically targets the periodontium. Now, you might be wondering how gum disease can actually affect the rest of your body, because most patients actually don't take their oral health that seriously. But it does, in fact, actually affect your overall health, and it can have some dire consequences. So basically, gum disease, it can range from just simple bleeding on brushing, okay, and a bit of redness of the gums, to something more severe where the bone and the ligaments surrounding the tooth have been affected, and this leads to tooth loss. So it can range from gingivitis, which is just inflammation of the gums, to something called periodontitis. This is where you start to notice that your gums have kind of descended down, or some patients say that, "Doctor, my tooth seems to be getting longer." So that's not actually the case. What's actually happening is that your gums are actually receding, so they are going beyond their normal level. So this is periodontitis, and you will also notice that your tooth gets mobile, and the end result of this will be that there is tooth loss. So if you're wondering what you can do to prevent all of this, all of these consequences, it's actually very simple. The first thing is that you should really get regular checkups, because the first person who can actually help you with this is your dentist, because we can spot the early signs of gum disease, and we can actually help you prevent any further progression before it's too late. Because once it goes into the stage of periodontitis, it definitely is irreversible. We can help you stop the progression, but we definitely can't bring anything back from there. So when you do notice that your gums are bleeding while brushing, then that would be the time for you to visit your dentist, and we'll take care of the rest. So from your side, what you have to do is you have to have a very, I would say, religiously, you have to brush your teeth, you have to floss. You, of course, have to brush. I think this is common knowledge now, not necessarily implemented very well by everyone, that you should brush twice daily. You should you should floss once, ideally before you go to bed, and a generic mouthwash routine is also preferable. So these are actually very simple steps that will actually save a lot of trouble in the future. Another thing that actually you should do is to stop smoking, because it's very harmful to your tissue, your gum tissue, and in your health in general. So that is a piece of advice that I know that it's hard for smokers to take, but it's actually quite vital. Other than that, in general, you should eat healthy, and just how eating healthy will have a good effect on the rest of your body, it'll definitely have a good effect on your oral health. And it's been found by research that people who have a better diet will actually show less signs of periodontal disease, and namely people who have omega-3 fatty acids in their diet actually show the least amount of periodontal disease. And let me just go back to the smoking and say that someone who actually smokes just half a packet has 3 times the chance of getting periodontal disease than someone who is a non-smoker. So you can actually see that that's actually quite a dire consequence of smoking. So you may be wondering a little bit more regarding a little more into detail. I'll go so that you have a clearer picture of what exactly the oral environment is like. So it's actually not much different than, let's say, your gut, where you have a nice population of bacteria, and it's known as, in the oral cavity, this is known as the oral microbiome. And these are basically your, they're friendly bacteria, they're always there, and they're actually keeping the balance in your oral cavity, just like they do in your gut, for example. So whenever anything happens to disturb this balance, okay, basically this makes room for more, let's say, hostile bacteria to come in and disturb the balance, and basically that's when gum disease will happen. Now, it can happen for many reasons. I won't go into too many details because that'll be like a lecture. So what I'm going to tell you is, according to actually many researchers in Harvard University, and not just dental and medical, they actually collaborated, both the schools and Harvard. So they've actually found a very strong association between, let's say, diabetes and oral health, or diabetes and gum disease. And not just diabetes, even cardiovascular disease, complications in pregnancy. So, I mean, it's not just something that I'm saying, it's something that's actually based in research, that having poor oral health that leads to gum disease will actually have consequences in other parts of your body, in other systems in your body. And I think this needs to be put forward more often, because normally the population or the society is not very aware of the fact that your oral health is really important to the rest of your body.